And I think I'll start up by saying, and I think those who've been will agree, is that the first thing I was really taken aback when I went to Gaza in December was the amount of children that are there everywhere. I mean, everywhere. And these are mostly elementary school age children. They're everywhere. And it's a blessing. I mean, you see them running around despite the conflict at that point. I mean, even in March, they're running around and they're relatively happy because, being children, despite having lost everything. And you know, but they're everywhere. So it's logical for anybody who goes there. You don't need any statistics to deduce that if something bad happens, whether it's a famine, a man-made induced famine, a reduction of supplies and medicines and food, is going to affect children. Infectious disease, mostly children. Infectious disease is going to affect mostly children. Deaths and injuries, severe injuries, will affect mostly children. Mental health will affect mostly children. So the list goes on, and that's really clear. And the statistic that came up a few months ago, that 70% of the women 70% of the people that have been killed or wounded in this genocide have been women and children, right? And so it makes completely sense. And that's the first thing that I noticed, and that's why this is a big problem. I mean, and they did that to a number of kids. So, but the mental health trauma of these children is unimaginable, and that's a big issue that we're going to face in this genocide. And I mean, the of course, infectious disease, skin diseases. And this is just a healthcare perspective I'm talking about, right? I mean, malnourishment that's going to affect the development of these children's brains and bodies is also prevalent. And that's going to have long-term ramifications of how these children will develop. And, everything I'm saying, I will say, is known to the Israelis. This is all done intentionally, and they've actually spoken about it, and by plan. Nothing is going by accident. It's all by plan. And you really feel that when you're on the ground. You say, this is like a maniacal plan, and it is a plan that's been really done to ethnically cleanse the population, right? And they know this. That's why this continual displacement from one zone to the other. So you have to evacuate. You go to the other zone. They start bombing that zone. They know that, unfortunately, because many of these children are injured, so are the adults, mind you, and they're sick and they're malnourished. In their migration from one evacuation zone to another, many will die. So you lose more, right? You'll lose more because they don't have any transport. They're walking on foot, in shopping carts, or being held, or whatever. I mean, these kids with many are left behind because they can't move, in hospitals and whatnot. And and over 1,000 healthcare workers that we know of killed. So I mean, it is very dire. There's really, I mean, the only good